The truth is that giving this talk is a challenge because there is a lot of supplementation for the locomotor system, and I would like to provide you with the basics of the basics. Fundamentally, what I consider we can all have, let's say, in a very essential first aid kit for both prevention and treatment. Before starting the talk, I will explain some very basic concepts about osteoarthritis so that we can later understand when and how we can provide supplementation. Osteoarthritis etymologically comes from the word arthros, which is a Greek word meaning joint. Many people talk about osteoarthritis as if it were the famous rheumatism. Well, rheumatism etymologically in Greek was also used by Hippocrates in the 5th century BC to refer to a flow, associating it with inflammation. We cannot associate osteoarthritis with inflammation because sometimes osteoarthritis does produce inflammation, but not all inflammations of a joint are due to osteoarthritis. There is osteoarthritis that is septic, due to infections, autoimmune diseases, or trauma, for example. So it is important to make that distinction between those two concepts. Something that is also very important to keep in mind is that pain informs the brain through a system called the nervous system. There are people who come to my office and say, "I'm dying of pain, and I'm full of osteoarthritis," as if they were full of moles, right? So one thing doesn't really have to do with the other. There are pathologies that make the nervous system completely hysterical, and any stimulus coming from the body, no matter the source, whether it's too much light, wearing inappropriate footwear, or walking on overly steep terrain, sends pain signals to my body that the brain ultimately cannot differentiate. So, osteoarthritis does not mean pain is synonymous with it either. Does osteoarthritis hurt? Yes. Are all pains due to osteoarthritis? Not necessarily. For supplementation, just like for any activity in medicine, it is very important to make a correct diagnosis. Many times, due to the overload of patients we have in consultations, when someone comes in with knee pain, you have osteoarthritis, just like that. And maybe we look at the X-ray and the X-ray is normal. What I mean is that a knee can hurt because we have tendinitis, because we have a meniscus issue, or because we have a radiculopathy coming from the lumbar region. Be careful. Once I received a message on WhatsApp, which WhatsApp drives doctors, and any healthcare worker crazy, asking me what medication I was taking for shoulder osteoarthritis and that it wasn't doing anything for them. I suggested to him that if what he was experiencing was really pain coming from shoulder osteoarthritis, it could also be referred cervical pain, or it could be a rotator cuff issue. In short, we need to be careful with this. Well, having explained these three basic concepts, which I will refer to throughout the talk. This is what osteoarthritis means: the passage of life through the cartilage. As you can see, what is rounded in that horrendous thing, that wonderful pearly pink condyle that we have so cute and that performs its function perfectly, wears down over time, and not necessarily due to age, but due to other factors that we will see now. And it can produce pain, especially in certain situations. What is happening here? We have either a situation of constant impact that is not very strong, or a significant trauma, along with a systemic condition that is not the most suitable, which produces a disruption in the production of the appropriate matrix in creating healthy cartilage. So, if we do not produce healthy cartilage, wear and tear will prevail. And when we have wear, it affects the cartilage. And when it is already very advanced, it also affects the bone, which is the subchondral involvement. The reasons for the onset of osteoarthritis can be due to trauma or mechanical stress, prolonged immobilization, and the fact that both the creation and destruction of cartilage do not occur in an adequate manner. Acute and chronic inflammation. Watch out for metabolic syndrome. Metabolic syndrome, tension. Hypertension, to be more precise, hypertension, hypercholesterolemia, insulin resistance, or diabetes. What this does is create a generalized state of inflammation in the body with a focus on the joints. Joints are somewhat like the lymphatic duct. It's where all the waste is dumped. So the worse our systemic state of inflammation is, the more the joints will suffer. Hormonal status plays a significant role. Women after menopause clearly experience a high incidence of arthralgia. Excessive joint use is also a factor. Those who have spent their entire lives working as oxen drivers know this very well, as do high-level athletes. This is why we know that these athletes, who have pushed their joints to the limit, often find themselves in poor condition by the age of 50. And of course, aging is a contributing factor. What symptoms does osteoarthritis produce? Well, We all know more or less: pain, stiffness, creaking, deformity, and swelling. General inflammation. As we can see, these little injuries are generated within the cartilage, which ultimately also affects the bone. So these are the basics of the basics that I'm going to discuss. There is so much more, and we cover this extensively in the master's program. So here, we need to distinguish between acute and chronic treatment. And above all, the most important thing we should focus on is prevention. Anti-inflammatories, obviously, when we have inflammation, we need to try to reverse it. What kind of things can we use for this? In addition to conventional medicines, we have devil's claw, ginger, and the famous turmeric. When it comes to protecting cartilage, we have chondroitin, glucosamine, and of course, collagen, which are essential components of cartilage. Why am I mentioning neuroimmunomodulation here? As I just explained, pain in osteoarthritis is not solely due to joint degeneration. In general, a joint can be affected by more than just cartilage or bone involvement. If we have nerves that cause us pain, this will be very beneficial, and if there is an immune situation that is also causing us to become more inflamed than necessary, both vitamin D and omega-3 will help reduce all of this. And the synthesis of collagen. Can you tell me what is the difference between chondroprotection and collagen synthesis? Well, here is a difference between what I am discussing regarding prevention and what treatment is. If I am a person who has a more or less good baseline state without much osteoarthritis or degeneration, what I will need is to provide my body with the ingredients so that my own body can produce what it needs. Both vitamin C and silicone are essential, along with other factors, for the synthesis of collagen. So it's like I want to prepare my food because I have very skilled hands, and then I take my amino acids on one side, I take my vitamin C, and I make my collagen, and I just incorporate it. What happens is that these mechanisms over the years, or with very severe inflammatory states, are no longer as nimble. They are not as skilled. So it is much easier for the body to assimilate them when we provide them in a manufactured product such as collagen. So we need to assess whether it would be better for the patients to provide the ingredients for them to make their own cake, or if I should just give them the cake directly. Well, speaking of anti-inflammatories, this is a horrible chain, impossible to learn. At least I am not capable of it. But it is very important to understand what the anti-inflammatory mechanism of these components is. Arachidonic acid is a substance that is generated in situations of both acute and chronic inflammation and has two expression pathways. One is cyclooxygenase 2, which is the one you have underlined here, and the other is 5-lipoxygenase. They produce different things, but to keep it simple, both produce inflammation. What happens is that if we block that inflammatory cascade, what will occur is a reduction in inflammation. Where do these substances act? Well, on the one on the right, in the one on the left that we saw a moment ago, devil's claw, ginger, and turmeric act. Additionally, ginger has the potential to act on 5. Lipoxygenase as well, which we will name. Well, devil's claw. Let's say there are many conventional anti-inflammatories that act through this pathway, through cyclooxygenase 2, with their side effects, just as devil's claw may also have. But notice what other situations it covers. Devil's claw, apart from its anti-inflammatory and analgesic properties, is also antioxidant, which is already beneficial for us. It also tends to lower blood pressure in patients who are undergoing antihypertensive treatment, which should be taken into account because it can lead to low blood pressure. In addition, sugar is hypoglycemic, diuretic, and promotes healing, which is great for diabetics because, as you know, diabetics have issues with healing. And it also stimulates appetite. So this is good for very elderly people who also have a lack of appetite and are anorexic. If there are no things in themselves, there are no things in between. It is a very good option for controlling inflammation. Ginger. We have seen that ginger acts through both inflammation pathways. The problem with ginger is that, well, taking it in therapeutic doses through food is a bit complex. It's somewhat complicated, as we need slightly higher doses. Additionally, it is used for the prophylaxis of dizziness that travelers experience, such as people who get motion sickness while traveling by car or bus. It also works for those who are pregnant, acting at the digestive level, and promising results are emerging for the metabolic syndrome we just discussed, including hypertension, hypercholesterolemia, and diabetes, which also influences the development of osteoarthritis. Therefore, it would not only be anti-inflammatory at the local level, but also at the systemic level. Turmeric. This turmeric that everyone knows, which comes in curry, that everyone tells us must be taken together with piperine from black pepper to be effective. We can save this if the turmeric is liposomal or protected to pass the gastric barrier. 2009 is a natural anti-cyclooxygenase 2 that is very well tolerated. In general, it is an option to always have in the medicine cabinet in case we experience any type of inflammation. We will explain what chondroprotectors do with this metaphor in simple terms. Well, if we take a microscopic zoom inside a cartilage, what we ultimately see are those thick strings that we see. Those blue ones are collagen. Collagen fundamentally provides tension. It helps keep the joint structure in place. In contrast, everything that is orange and reddish within the drawing is hyaluronic acid, which you will be familiar with because it is often consulted in traumatology, especially in the knees. When people have, let's say, a cushioning or suspension problem, any type of impact causes pain. Hyaluronic acid with these tiny fibrils that extend to the sides, which are chondroitin sulfate and keratin sulfate, makes it viscoelastic, thus providing resistance to compression. Any impact will cause these substances to help the joint resist, which means that collagen, which makes up 60%, helps maintain its shape. 2009, chondroitin and glucosamine in our case, along with hyaluronic acid, would help prevent the joint from deforming due to compression. This is the structure of hyaluronic acid that I just explained to you, which would be the central axis where all these proteins unite, including keratin sulfate, glucosamine, and chondroitin. Why is that important? The negative charge that I highlighted in red, because they repel each other. It is necessary for these structures to repel each other so that they do not attract one another and can withstand compression. Neuroimmunomodulators. For me, this is fundamental because pain in the locomotor system arises through the nervous system. So the better we modulate the nervous system, the better. What is happening? Here we are addressing it in patches. We are treating it in a completely separate manner. But I want you to understand that everything is interconnected. Nothing we do in the body goes without having an impact on another system. We talk about the psychoneuroimmunoendocrine system. Everything works together. Therefore, the more we regulate all these factors, the more important vitamin D and omega-3 will be at the level of pain. Omega-3 is divided into two substances that have specific names: eicosapentaenoic acid and docosahexaenoic acid. It is terrifying and both are fat-soluble. Why do I mention this? The war against fats that is happening now. We have patients with very low levels of fats. What is happening? We cannot synthesize this naturally. So, it is important to consume fats, but they should be good fats. The nervous system is made of fat. Therefore, one should also exercise some judgment and discern how far certain commercial interests are going. I am a total fan of vitamin D and it shows. Why? Because vitamin D is really not a vitamin. It should be called a hormone. It is actually a prohormone that has a tremendous systemic action. It is absolutely necessary for a lot of things. It influences cancer infections, psychiatric disorders, autoimmune diseases, as you can see here, 2001, cardiovascular risk factors, osteoporosis, and multiple musculoskeletal pathologies. Why? Because vitamin D is essential for the psychoneuroimmunoendocrine system that I just mentioned. So, when all of this is lacking in vitamin D, it affects its clinical expression. It seems like just seeing the drawing, but that is, let's say, a bird's eye view of all the actions that vitamin D has. Can you imagine that it's not just calcium and bones? It has a multisystemic action, and Jorge has already outlined what happens to vitamin D. It has a little key in the nucleus of the cells. What for? To enter and extract information from the DNA. Continuing with the cooking analogy, If DNA is the recipe book that I need to extract information and create the things my body needs, it requires vitamin D to read it. It's like the little key. It's like the lock. If I don't have vitamin D, we will lose the ability to extract that information for the body's own recovery. Interestingly, this nuclear receptor is found in almost all cells of the body. There must be a reason for that. Nature is wise. Vitamin D is a steroid prohormone, which means it comes from fats. So how is vitamin D generated? On one hand, we need cholesterol. Our body needs cholesterol. It is the mother substance. And to activate it, we need sunlight. What happens to us? When I leave my house at 6 a.m., it is still dark. I go into the office, I am under the desk lamp, and when I leave the office, it is 5 p.m. In winter, it is already dark. Overall, I don't get a drop of sun, and we live in Spain, which is a sunny place. It's a bit like what they just explained about Finland. And if I also follow a very restricted fat diet, my vitamin D is not generated at all. Endogenous synthesis is the main source of vitamin D. If I don't generate it with my own resources, I will need to take it. So this is a summary of the main functions of vitamin D. Notice that I don't include the topic of bones, as I am a rehabilitation specialist, because for me, the genetic control of DNA is much more important. This is a T lymphocyte. I present to you a lymphocyte of the immune system. If driven crazy, it will wear you out. Immunity rises and causes a lot of inflammation, and the nervous system is made of fat. We need vitamin D for its proper functioning. In fact, there are certain neurological diseases where high doses of vitamin D are already having their effects. Omega-3 is something similar. It comes from fats. Omega-3 is present in all cell membranes. Importantly, an adequate cellular membrane will ensure that besides having its own identity and proper functioning, it can let out what it does not need and allow in what it requires. And it is also very important, like all fats in the nervous system, what is happening to us now with omega-3? Well, we have a consumption, at least in Spain, that is quite low. Now we consume more white fish than blue fish, and the blue fish we consume is farmed. You can imagine what the food market is like among livestock, what they feed the livestock, how the livestock is treated, and the fish farms, where the same thing happens. And this trend of fast food and all the junk we eat makes us completely unbalanced. We eat too much processed food with very cheap vegetable oils, which causes omega-6, the friend of omega-3, to be unbalanced. We should have a level between omega-6 and omega-3, approximately omega-6 2.3 and omega-3 1. How are we doing now? 20 to 1. Omega-6 and omega-3 are fundamental in a lot of processes. If they are balanced, omega-6 is not bad. It should be consumed, but it has to be balanced. When it turns out that omega-6 is elevated, it triggers arachidonic acid, as I mentioned at the beginning, and inflammation is set in motion. Here, in this publication, they say that humans in the past reached a ratio of 1 to 1. In fact, they say that human evolution occurred because humans began to fish and eat blue fish, which led to the incorporation of omega-3 into the nervous system, and from there, intellectual development took off until today, when it seems we are heading downwards again. The plant foods richest in this, which is alpha-linolenic acid, are flax seeds, chia seeds, and walnuts. Nuts, mind you, nuts are with the shell. If we remove the shell, they oxidize, unfortunately. So it's very convenient to buy the bag from the mall as it is, but ideally we should crack the nuts ourselves and use rapeseed oil, of course, the non-toxic kind, obviously. Blue fish is also a wonderful source of omega-3. However, there's a catch, because large fish like salmon, tuna, and bonito, which are fatty, are so delicious. What is happening? They are fed up with heavy metals, so we need to try to rely on the smaller fish. So sardines, mackerel, anchovies, because we are going to incorporate them into our metabolism, come on, not so much junk. By controlling omega-6 in an adequate proportion, we have structure, protection, and regulation of the cells. Due to its membrane mechanism that we have just seen, it is a good anti-inflammatory and promoter of the immune system. It regulates the coagulation cascade and the balance of the lipid profile as long as it is balanced. Here you have different oils, such as sunflower oil, corn oil, sesame oil, peanut oil, and of course our wonderful olive oil. The synthesis of collagen, this is what I just mentioned to you. This image here of the snake is the symbol of the medical college because it represents Panacea, who was the daughter of Asclepius, the one who heals with medicines. Vitamin C is not a panacea for me because it does not cure everything, but it should be present in large doses in our entire diet. Why? Because we live in a state of generalized inflammation, and if we already exercise or have some type of high-impact work activity, we should do it in an intense manner. In fact, Linus Pauling said that he died earlier, evidently at the age of 93, because he had started supplementing late with vitamin C and vitamin E. This, on the other hand, is water-soluble. What this does is that this vitamin carries away certain things, such as inflammations, as we will see now, heavy metals, and can take them for elimination. It is a factor that is needed for a lot of things. The synthesis of collagen, carnitine, catecholamines, it improves iron absorption and is antioxidant. Fundamental. Here for cancer issues, as well as for cardiovascular risk factors, both for heart attacks and strokes. And here what I'm sharing in this post, which reduces bronchoconstriction in people who exercise. What a wonderful situation, not having to deal with the wheezing all day, right? And here, as I was mentioning, it is also a chelator. We have lead in abundance. We live in very polluted cities. Silicon, for me, is also a substance that, along with vitamin D, allows us to form our own collagen. It is present in products like bamboo and horsetail, but be careful. To reach an adequate therapeutic dose, we need to consume a lot of this, and it is really not viable. Silicon has shown very good results, especially for knee issues. Don't ask me why. I'm trying to find the patterns, but particularly for elderly people who have been offered multiple treatments but cannot undergo surgery, silicon is a very good alternative for advanced osteoarthritis. And well, without further ado, I have already mentioned the basics of the basics, and I want to leave you with a note that I haven't included, which is on the last slide. Although it is not specifically for osteoarthritis, magnesium is another one of the great essentials, because magnesium also influences a lot of enzymatic pathways and more. However, for muscular issues and tendinosis, it works fantastically, improves sleep quality, and lowers blood sugar. So I often recommend it as a resource. People who have, well, especially a lot of muscle tension, be careful. Magnesium should also take into account all the medications the patients are taking. It cannot be given to everyone. So let's stick to 4 key points. Supplementation is necessary both for prevention and for treatment. We need qualified professionals because, as has been mentioned earlier, this is not harmless, and we need to administer it in appropriate doses while considering the patient's profile. 2001 always needs to be personalized. And here we have a lot of resources that are truly wonderful for our health. Thank you very much.